What about, a lot of folks have raised issues about the timing of the durvalumab after the conclusion of chemotherapy radiation. Any thoughts you'd like to raise to that it appeared the people that started it sooner may have had a slightly greater effect of the whole regimen?
Yeah, and that's very clear, and it's a fairly dramatic difference. It's not a randomized observation, but it's an observation that I think is going to influence practice when possible. I think if people have recovered from the most serious acute effects of chemoradiation, I think the practice guidelines will look to starting it as soon as reasonable after chemoradiation. And I also am seeing that in the design of future studies, if the Pacific, for example, is the control arm of a study, looking to move that as early as possible. There's no evidence to suggest that toxicity is worse by doing that either.
Okay, so I'll ask you both the question: inoperable, unresectable adenocarcinoma and squamous carcinoma. Has this become a new standard for you to give concurrent chemotherapy radiation followed by durvalumab?
I always say, how could it not be a standard? I mean, with such a profound difference in progression-free survival, it has certainly had rapid adoption at my center, and we have started treating patients with it. Again, it's an interim analysis. Of course, I'm anxious about overall survival results, but it will, with such a big difference, it's going to be hard to really show a detriment in the other way.
Wally?
Yeah, I'd agree. Emphasizing that this is for good performance status patients who are able to get chemoradiation. This is unquestionably a new standard of care.
Yeah. I have to say that I'm more interested in the maturation of the progression-free survival curve, because only those people on the progression-free survival curve are going to be cured. And I think that is the ultimate test here. Are we really going to cure more patients? And I'm really hoping that with more time, we're going to see those progression-free survival curves mature. And I do think it's changed therapy too. The other issue is, how many decades, Wally, have we been trying to do this? We're maybe you're into the third decade of trying to do this. We've never succeeded. And in fact, in multiple trials, harm was brought upon by our interventions. Not trying to do that, but it happened. So this is really helpful.
When you look, the last positive trials were the sort of concurrent versus sequential trials.
Yeah.
You really, and so those trials
I had a lot of dark hair then.
Yeah, exactly. Yeah. We all did.